With so much happening in our lives every day, it's easy to miss medications, and that can seriously impact your health. That's where Proteus Discover really helps you take control. It's a program that typically lasts for 1 to 3 months, and it's made up of medications with sensors, a small wearable patch, and a mobile app. What's really unique about this program is the Proteus sensor. No bigger than a grain of sand, the sensor is made up of completely natural ingredients, and it's fully FDA approved. The sensor is coded to create a tiny pill. The pill containing the sensor is then put into a capsule along with your medication by a pharmacist, as prescribed by your physician. The wearable patch goes just here. You wear the patch all the time, even when bathing or exercising. You usually replace the patch about once a week. Once you've taken your medication, the sensor is woken up by the fluid in your stomach. It sends out a signal, like a tiny heartbeat, which is only received by the patch. This confirms you've taken a specific dose of your medication. The sensor then simply passes through your body, just like the fiber in food. The patch signals the Proteus mobile app on your smartphone or tablet, so you can see you're up to date with your meds. In addition, the app shows which dose is due next. The patch also measures your steps, activity, rest, and heart rate. And you don't have to take any notes, it all happens automatically. You can enter other details too, like blood pressure, blood glucose, and weight. Your data is fully protected, so you choose who sees information about your medication taking, your family, for example, as well as your healthcare team. What's important is that now your care team can see a bigger picture of your health. That means you get to have better conversations about your needs and get treatment that's tailored exactly to you. Proteus Discover is simple to use and helps you get the most from your medication so that you can look forward to a better quality of life.
This thing has over 5 years of development, thousands of thrilled beta testers, and one common reaction.
That is so weird.
That's so weird.
That's like super weird.
It's kind of weird.
That is a little weird. That's weird. That's so cool.
That's crazy.
Try it.
That is wild.
That's nuts. I feel like I can jump right now. I just tore this ACL.
Let's rewind real quick. One thing we all share on this planet is pain. Let me show you. This dude, trumpet elbow. This hombre, saddle sore. These kids all have headaches, except for this kid. He's fine. You know why no one smiles in old photos? They were all in pain. And sooner or later, we'll all experience it too. Young, old, athletic, it doesn't matter. I'm Bart, by the way, 48, 20-year husband, 3-kid dad, and I'm a coach. I know a little something about pain. The pain seems like one of those constants in life. But how did we get to 2019 with just this stuff? We can do better. And a few of my friends have done better. This is Kylo, and it's the future of pain relief. Kylo is different than anything you've seen before because it's the world's first nanotech developed specifically for relieving pain. Unlike other products, Kylo contains zero medication. Instead of adding something into your body, Kylo uses billions of charged nanocapacitors that work like a bioantenna. Kylo supports your body's natural ability to relieve its own pain. You simply place Kylo on your body between your brain and the pain. And within seconds, you'll experience relief.
It actually feels a lot better.
By the way, it really works. For me, my family, the players too. I could go on. But let me show you some stoked Kylo users.
So I have really bad knees from running for years and years. It's like in the back of my knee, like on the inside.
So if you were to rate it on like 1 to 10, where would you put it?
Probably like a 7.5 right now.
So it's pretty bad.
Yeah.
So I'm gonna put it right here.
Is it supposed to tingle?
It can. Some people will feel it.
Okay, yeah. I feel it warming up.
So your pain was at, what'd you say, a 7? 6.5, 7? Is it any different now? it's still the same.
This is like witchcraft. It's probably around a 4 to 3.5.
I want to see if we can get it even lower than the 3 and 4.
This is better.
It is?
Mm-hmm. Yeah, it's probably at a 2. This is freaky. So weird.
Oh my gosh. It's like gone. It's way better.
Good.
I can't believe that. What is this?
Okay, hold on. I would say it's drastically decreased the pain level.
It's kind of weird. This would have been nice to have this morning when I was cleaning.
It is weird. I don't feel it now, so I don't know. Yeah.
Oh, wow. That's nuts. I feel like I can jump right now. I just tore this ACL. That's awesome.
That's so weird. I immediately feel my hands not hurting anymore. So weird.
That's cool. That's crazy.
I'll be darned. Look at that.
Before, I would get up and go, okay, let's see if I can walk for a minute. And getting up like this, I mean, it's like, wow, that it's not there. It is not there.
Hey Indiegogo, I'm Stuart, founder of Kylo. We want to bring this incredible technology to market in a big way, and we need your help. We've already contracted with a manufacturer. We've produced a small initial run of Kylo, so we know everything is ready to go. Now we just need the push from this community to go into full production and get this amazing product into the market. There are billions of people with pain, and we want to help as many as we can.
Kylo is legit, my friends. We've really seen some amazing results. I hope you back Kylo today and experience the future of pain relief.
To be revolutionary, you've got to do things that have never been done before.
I knew a few people that sort of say, man, this is almost impossible. But for me, I never really thought of it being impossible.
I mean, this is the ultimate wearable, really.
There's over 400 million people around the world that have been diagnosed with diabetes, and that's projected to grow to over 700 million in just a few years. It's one of the world's top healthcare epidemics. The opportunity to be able to impact that is incredibly important.
Our first wearable device at Abbott was the Freestyle Navigator system, and it uses this great wired enzyme technology, but it was a first-generation product, and it needed calibration. I've spent my entire career trying to help people move from using these single-use devices where you have to prick your finger and you get a single reading in time and it's quite public, and we thought that it really didn't need to be that way. Continuous glucose monitoring is one of these changes in how people understand their glucose that only happens every 20 years. Our challenge was, how do you make a sensor stable enough where you don't need to use finger sticks anymore to calibrate it in the first place?
Factory calibration eliminates the need to prick your finger.
When I joined the company, there was one person who had the steady enough hands in order to be able to put the enzyme drops on a sensor on the order of 1/10 of the diameter of a human hair. That was Fu.
I was able to test and develop the sensor that we were looking for.
Part of what we tried to do was to make machines that could do what Fu could do with his hands. That was really the beginning of a revolution.
Shortly after I was diagnosed, back in 1993, the state-of-the-art blood glucose monitoring product took 45 seconds to work and took an enormous blood drop. And I had this dream of having a device that I could just look at and it could tell me what my glucose level was. We have Freestyle Libre in over 42 countries where people can do exactly that. It's the full realization of that dream.
We want to make a system that's seamlessly part of your life.
For me, it's just, a great joy. And to see that from just laboratory work into real life stuff, I don't think you can feel anything better than that.
when ophthalmology met microtechnology in the year 2003, it gave birth to an innovative startup company called Sensimed, based in Switzerland. With its principal focus on design, development, and commercialization of integrated microsystems for medical devices, Sensimed has developed a telemetric sensing contact lens, which embeds a miniaturized microprocessor and wirelessly sends the information to an external and portable device. The goal of this groundbreaking technology is to provide an automated recording of ocular dimensional changes over 24 hours without physical connection or battery supply to the contact lens. This technology is currently used by eye doctors to further improve glaucoma management in patients at risk of progression. For more information, visit our website at www.sensimed.ch.
Each day, millions of Americans carry and use inhalers to relieve asthma and COPD symptoms. How often a person uses their inhaler indicates how well their disease is managed. The propeller sensor is a small device that attaches easily to most inhalers. It automatically determines the time and location when the inhaler is used, because revealing where people use their inhalers provides valuable clues about environmental exposures that cause attacks. Our FDA-cleared mobile solution helps patients, physicians, and public health agencies systematically manage COPD and asthma in real time, so they can put the latest information to work to better understand and control respiratory disease.
Insulin is an amazing and life-saving drug, but it's also a dangerous drug. Unlike any pill you might take, insulin has no fixed dose or timing, leaving you to constantly calculate doses and configure devices, living with the daily reality of either too low or too high glucose. And your healthcare provider likely has too little time and too few resources to support you as they'd like. We want to change all that. Bigfoot Biomedical is developing the first and only digital drug delivery platform for insulin, founded by those who know firsthand about living with it, for people with both type 1 and type 2 insulin-requiring diabetes. We're reimagining insulin therapy with the goal to make it intelligent, comprehensive, complete, and centered around you, whether you use injections or an insulin pump. Seamlessly and securely connecting all the devices, adding intelligence, and leveraging data to continuously adjust to you, as well as provide information to you and your healthcare team, all delivered as one comprehensive care solution, one prescription, with an auto-fulfillment subscription service. We want to free you to live the life you choose, a life that doesn't have to be spent thinking constantly about diabetes.